Good afternoon. Welcome and thank you for joining us here with Family Network on Disabilities Family STAR program. The STAR stands for support, training, assistance, and resources. My name is Latasha Bird. I'll be your facilitator today. And our goal is to help families become effective partners in their healthcare decision-making at all levels and report satisfaction with the services that they have received. Now, today you are here for one of our webinars. Today's webinar will be entitled, How Do I Choose an Adult Healthcare Provider and Make My Own Doctor's Appointments? So without further ado, let's go ahead and start the webinar. How do I choose an adult healthcare provider and make my own doctor appointments? We want to say welcome, thank you. We're glad that you stopped by to find out a little bit more information today with our family-driven and family-centered nonprofit 501c3 within Family Network on Disabilities. We are here in the state of Florida. We want to make one distinct clarification before we start, is that we do not act as attorneys or doctors or even mental health professionals. However, what we do is provide information and resources and support to those families so they can make informed decisions about their loved ones with disabilities. Today's webinar will talk about healthcare choices. What types of doctors that you will engage in. How do you make those choices for yourself? Let's talk about some of the types of doctors that you may encounter and their staff. So pediatricians, you see at first. Pediatricians are doctors who are trained to take care of infants. They take care of children and even teens. Pediatric nurse practitioners, you see second, PNPs. These are nurses who have received special training to take care of infants, children, and teens. Family physicians are doctors who are trained to provide primary care to both children and adults. The next one you will see is family physician and internist. An internist is a medical doctor who specializes in internal medicine. This branch of medicine covers a wide range of conditions, and they can affect the organs inside the body. Internists only work with adults and not with children or adolescents. You'll also see a primary care provider or PCP. These are doctors who take care of patients and they know all about all of their healthcare needs. This doctor provides both the first contact for a person with an undiagnosed health concern, as well as continuing care of varied medical conditions. So the primary care provider can take care of many of the healthcare problems that people have, and they help patients find a specialist if they need a special test or special kind of medical services. Everyone should have a primary care provider, that's the PCP, who can help them get the health care that they need. They act as the gatekeeper, if you will, of our overall health. There are also nurses that you see here. Nursing job duties include communicating between patients and doctors. They care for patients and they also help in administering medicine. Medical assistants are those who will work alongside physicians, mainly in outpatient or ambulatory care facilities such as medical offices and clinics. They take care of all the medical history and they record vital signs for the patients. Now you also see specialists here. Now specialists are doctors who treat one kind of health problem, or they treat problems in only one part of the body. For example, this is what an example of a specialist would be. An oncologist is a specialist that will care for patients who have been diagnosed with cancer. A cardiologist takes care of problems with the heart. A psychiatrist helps people when they have problems with how they think, how they feel, or even how they behave. Now, specialists usually do not deal with health problems that are not in their general area of specialty. So you want to pick a doctor. These are going to be different people who are able to help you within those general guidelines of which types of patients they help. Starting with this top left box, we're going to read these scenarios and figure what type of doctor you would be able to use in this scenario. So starting with the top left, Sue needs to have a surgery. What kind of doctor would do the surgery? You can comment in the chat. Let's move on. Sue needs to have a yearly checkup. What kind of doctor should she see? If you know, please post your answers in the chat. And finally, let's try the lower bottom right. Sue's 10-year-old sister has a tummy ache. What kind of doctor should her sister see? Post your comments in the chat section. Did you come up with surgeon for the first? How about the second one? Sue needs to have a yearly checkup. What kind of doctor should she see? Family doctor. And moving on, Sue has a fever and a runny nose. What kind of doctor should she see? Family doctor as well. With the bottom left, Sue needs to get her heart checked. She would see a cardiologist or a heart doctor. Also, Sue thinks she may need glasses. What kind of doctor should she see? An eye doctor. And finally, Sue's 10-year-old sister has a tummy ache. What kind of doctor should she see? Pediatric doctors. How did you do? How many were you able to successfully identify? Let's talk about transition to adult healthcare. Now, within this, we understand going from being seen for things that would happen with children and moving over to that transition to adult healthcare might be a little bit of a challenge. Healthcare transition is the process from changing from pediatric to adult care, from pediatric to adult care. So there are significant differences between adult and pediatric healthcare models. Pediatric care with infants, children, and adolescents, they are more family oriented and they rely on parental involvement in making those decisions. However, when you transition to adult healthcare, that's guided by the patient themselves. That would be you as the person being able to make those healthcare decisions, and it will require that you have independent skills to be able to do so for yourself. Now, healthcare transition it's important. It's important for all youth, even if they don't have any type of disability or special need, in order to ensure that they are functioning and have they are functioning and well-being. So transition from child or pediatric into adult healthcare is specific. It's specific to each individual, and it should occur between the ages of 18 and 21 years. You are given more independence and treated as an adult. You have also received health care, adult health concerns. Your doctors are going to be knowledgeable of those ongoing conditions that you have in adults and preventative care, such as screening of adult health problems as well. They'll also help you with concerns such as sexuality, conditions that come with age, and even your reproductive health. And at the final button, you see having more control over your healthcare team. You can decide who will be on that team, and that would include your parents if you so desire. So let's talk about what it looks like versus each one of these aspects: pediatric healthcare versus adult healthcare. So as you begin thinking about transitioning from pediatric care over to adult care, you'll see mostly adults mainly in this type of environment. It'll help you to prepare in knowing what to expect. Now, no two experiences are going to be exactly the same, but here are some examples and some differences that you may find in teens and young adults, which we have seen shared with our parent trainers. So you want to compare and contrast each environment as you read through this list. Let's take a few of them. So with pediatric healthcare, we spoke a little bit earlier about them focusing on the family. Adult healthcare focuses on the individual. With a pediatric healthcare, the doctor may spend more time getting to know you and your family. And with adult healthcare, medical appointments may seem shorter or even rushed in some instances. And with pediatric healthcare, you'll see if you're under the age of 18, parental involvement and consent may be needed, and the parents are advocating for you. So with adult healthcare, you'll see those relationships may take a while to establish, and if you're over the age of 18, you must give permission, if you so desire, for parents to be in the exam room, to even see your test results, to discuss findings with doctors, or even have access to your medical records. You are your own advocate. You advocate for yourself. So these are some of the ways that you will see differences in pediatric or childhood healthcare versus what you would encounter in your healthcare as an adult. Self-awareness, and these are different things that you may need to know. Now is a good time to learn as much as you can about your healthcare needs. So here are a few things that you may want to be aware of. First, you see your health condition and or your diagnosis. You want to tell someone the name of your health condition or what your diagnosis would be. And with medications, making a list of medication, especially if you're making sure that you have their name spelled correctly, what the dosage is, when you should take your medication, and why, understanding why you take them. Next, you see how to stay healthy. There's going to be able to understand and know about healthy habits, such as having a good diet, having good sleep habits, practicing great hygiene, and even exercise. And finally, what to do in an emergency. What do you do in the case of emergency and you have no family around? Can you call 911? Do you have other people that you could call? And where do you go if you need to go to some place? Say you need to go to the emergency room. Do you know when you would need to go to the emergency room? And do you have things in place or a ride to be able to take you to those places? These are all things that you may want to think about as being self-advocacy pieces and things that you should know within understanding how to advocate for yourself in the adult healthcare system. So what do you expect when you go to a doctor's appointment? This is going to be a time that you and your doctor agree to meet, and you will discuss concerns that you may have about your body or discuss ways for you to keep possibly from getting sick. These are going to be a few reasons that you would be able to visit for a doctor's appointment. You have an annual or a biannual physical. Biannual means every 2 years. Annual means once a year. Sick time is a time that you, if you are sick, that's a time, excuse me, that you may want to visit a doctor to find out what it is that is wrong with you. Also, for vaccinations or refill on medication. And finally, follow-up appointments as well. So we talked about a couple of the reasons that you may want to visit a doctor and to make an appointment. When you call to make an appointment, you may be asked for the reason that you are calling. You want to be sure to give them as much information as you can. So when you're with your doctor, it's very important that you explain in detail what kind of sick you have. What kind of symptoms that are you feeling? How are these things affecting you, and how are you experiencing them? So by providing this information, it can make it easier for your doctor to figure out how to make you feel better. Think about it this way. If you just tell your doctor that you have a headache, it may not be enough for the doctor to be able to help you. You want to be sure that you tell the doctor where your head hurts and where in your head you feel the most pain, how strong the headache is, and how often you are having these headaches and how long that they last. You want to be sure to be able to explain all of those things. Explain any other symptoms that you may be feeling as well, like perhaps having a fever or a runny nose, stuffy nose, or even a sore throat, or just feeling general weakness in your body. Remember, the more information you can provide, the better. If you feel sick, what kind of sickness do you have? How are you feeling? So you want to prepare and make your doctor's appointment. We talked about what kind of sickness that you have. Remember what we said before. The more information you can provide, the better. If your symptoms are very bad, the doctor may want you to go to the hospital and tell all of the symptoms that you are seeing and all the ways that you are feeling. You can use pen and paper as well. You may need to both write them down, all of the information about your appointment, such as your date, the time, the doctor that you'll see, and anything you may need to bring, or any special instructions like come in on an empty stomach because the doctor may want to run some blood tests. So these are also ways that you want to prepare in making your doctor's appointment. Use your calendar. Make sure that you don't schedule a doctor's appointment or during a time that you are supposed to be somewhere else, or when you do not have a ride that is available to take you. You also want to have your calendar handy to write down that doctor's appointment as soon as you can, so that you don't schedule anything in the future during that time, or simply just forget it. And transportation. You always want to make sure that you know how you're going to get to your appointment. Are you going to take a bus or a taxi, maybe an Uber? Family member be able to take you? How much will it cost? Would you have to make a stop somewhere else in accordance with the doctor's appointment? These are all things that you want to take into account, things you might want to think about. If someone else is going to take you, you want to make sure you know when they're going to be free and understand how you would need to contact them by even calling ahead to schedule that time, or making a phone call simply to the doctor's office. These are some of the things that you want to find out before you contact your doctor. Now let's talk about what you need to know before you make that appointment as well. You also would need to know, provide your name, your address, your phone number, and your birthday. Your name means you're going to give your full name, full first name, full middle, and full last name. You don't give them your nickname. If your name is, my name is Latasha. So I wouldn't give them a nickname. I would tell them my name. My name is Latasha Bird. But your friends and family can call you by your nickname, but you want to give the doctor the correct name, the name that you are always going by. You also want to give them your address. Now, this is going to be the address that you receive mail from, and most likely this will be the place where you live. This can include the address number, the street number, the city, the state, and your zip code. If you do not know these things, these are a good time to jot them down and keep them with you. Understanding also that you may need to provide your phone number. This is the number where you can be reached at any time during the day so that they then call you if they have results, or maybe you need to come in for a follow-up. You also want to give your birthday. That will be the full date, including the month, the day, and the year that you were born. You also would want to know what the doctor's phone number is, the insurance policy number, and also including your group number, any types of medications that you are taking, and your pharmacy. The pharmacy is going to be the location where you want to be able to pick up your medication that the doctor may have ordered for you. These are some of the things that may be asked of you in the doctor's office. You want to tell your doctor that you want them to send the medication order to say you're going to ABC Pharmacy on XYZ Street. Telling them that, right, just might not work sometimes if you don't have the background information for the pharmacy name and where they are located, because they might be more than one location for that particular pharmacy. So when you know the particulars, make sure that you are specific in the information that you give to the doctor. You want to make sure if you have insurance that you are able to provide them with a card. You're going to be asked about which insurance you have. This will be the way that your medical expenses will be covered for all of those illnesses, all of those diagnoses, those injuries, those conditions. You or your parents or your employer may pay a monthly fee for that health insurance company so that you can go to see the doctor for a discounted rate, or even simply a copay. The word copay means that you cover a certain amount or a certain cost of your visit, and health insurance company covers all that is left. So let's give an example. If your appointment is $125 and you have insurance, you may pay the $25 and your insurance plan will pay the $100. And if you don't have insurance, you may need to take $125 with you to cover the full cost of your appointment. So if you do have insurance, and you'll be asked for the name of that insurance, the policy number, and also the group number, which you'll find on your insurance card. Make sure that you keep it with you. It's also good to know and to make sure that your doctor's office accepts the type of insurance that you have. Some insurance companies will pay for you to see some doctors, but some will not. If you go to a doctor that's not covered by your insurance, you will have to be responsible for the bill if you do not have insurance. Remember, in the example previous, you would have to pay the whole $125. This may be one of your examples. So if you don't have insurance, what you want to ask how much that procedure will be, how much the lab work will be, any medications would incur costs for you. And if it's too much money for you to afford, ask what are your options, or could they do a payment plan? These are all things that you may want to ask. So with your medications, you want to take a list and have it handy for the medications that you use. And that can include even vitamins or supplements that you're taking. Some medications don't work well together, and it may make you feel even worse than what you are feeling right now. So you want to have this information that's going to help the doctor not to make that kind of mistake. All of these things are things that you may want to know before you are making your doctor's appointment. So you want to take time to make that appointment. Dial your doctor's phone number or use an automated answer service. Some doctors' offices have a person answer the phone. Some others may use an automated service that may say, press a certain number. Let's say, press number 1 if you want to make an appointment. These are some of the examples that you may come across. If you want to make an appointment with a certain doctor, or if you want a line for an operator, press a different number. These are things that you may encounter. You want to listen intently and find out what the number is and the name of your doctor. Then press that number and make your appointment. If this is confusing, you may want to wait on the line for an operator, or either press 0 or some other number that may be designated in that message to find an operator. Once you have an operator on the line, tell them that you would like to make an appointment with your doctor and see if they cannot connect you with the correct office. So if the phone is answered, you get to speak to a live person. Tell them, say, I would like to make an appointment with Dr. X, or whatever your doctor's name is, and then provide them with any information they may ask you. Now, on the day that you have your doctor's appointment, these are things that you want to take them. We talked about all of these things before. This is important. Make sure you have your ID with you. This will signify who you are and prove to the insurance company that it was you, actually you, that saw the doctor. You want to bring your driver's license if you do not have an ID card. Either one of those will work. If you have your insurance card, make sure that you bring it with you. The doctor's office will need to see this and understand what your copay is and be able to send the bill to them and not to you. You also want to have a doctor's appointment worksheet. The doctor's worksheet will have all the information that the doctor's office may request of you, and it's good to take this with you in case you forget. Sometimes this can be done ahead of time, and if so, the doctor's office will let you know by sending those items so that you can have them filled out before you show up for your appointment. Also want to make a list of questions and concerns, and these are good to have this list and make sure that you have all of those ideas jotted down, and so that you would not forget something once you get into the appointment. By not having this list, you may forget to ask your doctor something that's important for them to know and for them to help you to make you feel better. And remember, you also want to have your money together for your copay, and make sure that you take the money in the amount that you will need to make sure you can pay for your copay for your visit, if you don't have insurance. When you arrive at your appointment, you want to arrive early, at least 15 minutes early to fill out some paperwork. Some offices may request 30 minutes early. However, whatever the doctor's office requires of you, please try to adhere that. You want to check in with the receptionist. And this will most likely be a desk somewhere in that room or behind a sliding glass door. There will be people helping you that work behind that desk. Go to them and let them know your name and that you're there for an appointment. Give your appointment time and the name of the doctor that you plan on seeing. And sometimes there'll be a line to see the front desk or the check-in person. So be sure that you stand in line and speak to the person to let them know that you have arrived. Don't just sit down once you walk in. Please let someone know that you are present. Wait in the line, and when it is your turn, give them the information that they need. Give them your doctor appointment worksheet to help answer some questions that they may have as well, if you have brought that with you. And finally, you want to wait for the nurse to call your name after you've checked in. And this is the time where you would be able to sit down and wait. Go to where they tell you, wait for a nurse to come out, they call your name. Remember that the nurse may come out and say your full name and not your nickname, so you want to be prepared. If you're waiting and perhaps have the urge or you need to visit the restroom, let the person at the front desk know that you are going to the restroom in case your name is called while you have exited the room. So you want to make sure that these are some of the steps that you adhere to when you arrive at your appointment. So what happens when the nurse comes and they get your name? They say your name. Well, you'll go with the nurse and they will be able to record your height and weight. They'll measure you and make sure that you are maintaining a healthy weight for your height. They'll take your temperature and finding out whether or not you are in normal range or whether you have a fever. Fever might happen when your body is trying to fight off some infection or an illness. They'll also check your blood pressure. Now, maybe you say, what is blood pressure? Well, blood pressure is when your heart beats, it pumps blood all the way around your body to give it the energy and the oxygen that it needs. So as the blood moves, it pushes against the side of those blood vessels. The strength in which that blood pushes against that side, this is what it's called your blood pressure. If your blood pressure is too high, if it's extra strain on your arteries and your heart, this may lead to other illnesses such as heart attacks or even possibly a stroke. And then finally, they'll ask you, how are you feeling? What illness do you have? They may ask you, what kind of sick? Remember that inference that we used in previous slides? Remember, the more information that you provide, the better. So when you go in to meet with your doctor, he may ask you the same thing. What kind of sick are you feeling? Do you have any allergies? This would be a great time to tell them if you have any allergies that may be to food or possibly medications. An allergic reaction is when you get a rash or you swell up or you have a hard time breathing or even have other reactions after eating certain foods or taking certain medications. You also want to find out if you have lab work that is available. Your doctor may want you to go to the lab to test your blood or x-ray or have a urine test so that they can have a better understanding of what's making you sick and how to treat you. Or they may also discuss some results if you have already gone to the lab and had a workup done. This next portion is medication. The doctor may order some medications for you. You want to ask for those directions to taking the medication and what possible side effects may happen after you've taken those. And remember, ask questions. Ask the questions that are on your list and concerns about your treatment. Make sure that you have clarity and let that doctor know when you do not understand something. You want to ask them to write down what the treatment is, what the diagnosis is, also if needed. And then follow up. You may need to see the doctor again after you finish your medication to review that lab work, or even after a certain number of days even if you feel the same or if you feel worse. So these are things that you want to think about when you are talking with your doctor. Remember, you want to be glad and honest. Glad we spelled with an extra D. Let's talk about what they mean. GLADD. You want to give information. Remember, it's important to you to give your doctors an understanding of what your condition looks like and how it's affecting your everyday life. Sometimes healthcare professionals will focus on your symptoms and medications, and they don't see the big picture of your life as a whole. Remember, the more information you can give, that would be the better. Listen and learn. Remember, as a young adult, you are responsible for listening and remembering what healthcare professionals will tell you. Most people can recall usually 2 or 3 things that doctors tell them unless they write the information down or write those instructions down. So you want to take something with you, such as a diary or a notebook. When you visit the doctor, write down the information that you need to remember. Remember, you can ask questions. Ask questions about your health and keep asking until you get a full understanding. It's a good idea to write those things down and even take questions with you to help you remember all of them. You want to get a diary, a notebook, have those things available for you so that you can help the doctors to be able to help you. Remember, you can always ask questions. Some doctors let their patients send the questions to them in the email, and then they can respond in the same way. This is one of the ways that you want to make sure that you are advocating for yourself and not letting the time slip away from you without being able to ask those things that you would need. Remember, the next one is decide. You want to play an active role in deciding what needs to be done next and who is going to do what. Don't agree on a plan that you're not willing or even able to follow. This is your health. This is your wellness. We want to advocate for you in making sure that you stay healthy and have positive outcomes with your well-being. The second D will stand for do. Do your part in that following plan. So remember, give information, listen, ask questions, decide, and then do. So what to say even if you don't understand? Well, sometimes it's hard to understand. Remember what the doctor tells you. Sometimes they use words that you may not understand, or sometimes they may talk too quickly. Sometimes they give you way more information than you can understand at one time. Sometimes you may ask a question that they really didn't answer. So if it's better that if they give you something to read rather than just telling you, you can ask for written information as well. Sometimes doctors really do want patients to have information. They need to be healthy. So you need to know what it is that you don't understand. And when you don't understand, what they are asking for you. Here are some of the ways that you may say, some of the things that you may say if you don't understand. You see them here. Please tell me more about that. What does that mean in simple or plain English? Can you explain that to me again? Can you write that down for me? Where can I find more information about this? And finally, is there something you can give me to read? Finally, when you're getting ready to leave the healthcare provider's office, you want to check out. Remember, there was a procedure of checking in. Well, we also want to check out as well. Thank your doctor for their time and then check out. Proceed to the area that is designated for checkout. This will most likely be a desk right next to that exit door or to the waiting room. And if there's a line to see that person, remember, you want to wait patiently in that line for your turn and then speak to the person that's behind the desk and have them assist you when it is your turn. Remember, if you have a copay, they'll ask for that payment then. This is the time that you want to pay for them. Also, you may need a follow-up appointment. So if the doctor wants to see you in a certain amount of days or to recheck your medication or even give you information on lab results after the certain time, you want to be able to schedule that appointment at this time. Be sure to have a calendar ready or remember that notebook that you may want to take with you. Or if you're unsure when you can schedule a new appointment, let the person know that you will call them to schedule or reschedule that appointment. Remember when we talked about pharmacy information, make sure that you have both the name, the proper address of your pharmacy. They may ask you for a phone number as well. If you don't want to go to your pharmacy and then realize that your medication was sent to a totally different location. And finally, have information about your tests or lab centers. So if you're going to have lab work or tests that need to be done, ask for directions. And if you need to fast, meaning not have anything to eat prior to that lab work taken. When you fast, that means that you do not eat or drink anything several hours before you're going to have your lab work done. Remember, all of these things are going to help you to increase your self-advocacy in healthcare. Spend time alone with the doctor, without your mother, without your father, or your parents or other guardians or adults. You want to ask questions. Make sure that you have clarity. Ask as many questions as you would need because this is for your health. Remember, you want to speak up. Let the doctors know when you don't understand and keep asking questions until you have that final clarity. And answer as many of the questions that you can that the doctor is asking honestly and accurately about how you are feeling and how you are doing. Remember, becoming an adult can be overwhelming, and the process of transitioning from pediatric or childhood healthcare to adult healthcare can be overwhelming sometimes too. But we want you to remember, it's okay to ask questions if you don't understand. You have control over your health and your wellness. And with that, we want to say thank you for joining us for how to choose an adult healthcare provider with Family Network on Disabilities. Here you see our full range of regional programs here to assist you with all of those needs. We invite you to follow us on social media and visit our website at www.fndusa.org. Should you need any more information, please do not hesitate to contact us. You can reach us at 1-800-825-5736. Again, that number is 1-800-825-5736. And with that, we want to say thank you for joining us here today for how to find an adult healthcare provider. Should you have any other questions, please reach out to us, use the comment section or the telephone number that has been provided to you. At FND, we are here to help. Have a wonderful day, everyone. Take care. Bye-bye.